Hello, welcome to South Today. I'm Sally Taylor. The headlines tonight. Keeping mind and body together. The hospital teams tackling mental health issues on the front line. Tier 3 restrictions come into force just after midnight tonight in Berkshire, parts of Surrey and the area around Portsmouth. Despite hopes of being downgraded, Dorset remains in Tier 2 because of continuing pressure on the NHS. We've returned for the latest of a series of visits to the emergency department at the Royal Bournemouth Hospital. It's very busy. Almost 200 patients are referred to mental health teams each month. That's 10% more than last year. Our health correspondent Alastair Fee has been seeing them and work.
A&D is the busiest it's been since last winter.
Are you in any pain at all now?
This shift started full, with more patients coming in all the time.
Yesterday, I had no choice but to call 111. I was literally in a ball in pain.
It's mid-morning and Seema has been here since midnight.
Anxiety, I suffer anyway on a daily basis. So something like this coming into hospital is quite hard.
The most poorly patients are seen here. Many are very ill and need help immediately. A high number have a range of mental health issues. This year, that added pressure has never been greater.
You've always had the physical problems, but now, with the mental health increasing in the last few years, that extra pressure you didn't have to deal with before. You just didn't see that day in, day out.
Seema has pain in her head and neck and is waiting for diagnosis and treatment.
The minute I got here, it's like I just had to explain to the nurses, receptionists, you know, I have got high anxiety, I'm stressed, I'm worried. And the minute you say that, everyone's willing to help you, but it's just communicating that.
So I'm going to arrange for an assessment for you this afternoon, it's most likely to be, and that will be 2 doctors, one of them you know very well already, and a social worker.
Simon is one of the mental health nurses whose job it is to assess the most vulnerable and ensure they get the right support both here and in the community.
Lots of depression, lots of anxiety, some self-harm, alcohol, drugs. Isolation is one of the big factors, I think.
Hello, Pete. Hello. How are you?
Alongside the physical care, on the wards, mental health teams are working with patients like Pete who need support.
I can't see no future, really. Some of the staff here have come up and chatted to me and they're going to come and see me again this week.
He has MS, but is here because of a viral infection. He's been feeling very low.
Went quite far down. Didn't know what I wanted to do.
Common theme that I'm getting is that, oh, well, you know, it's difficult for everyone, isn't it? You know, why am I so different to anybody else? We're all struggling this year. And I think people are sort of unwilling to admit that actually it has affected them in a very significant way.
As this shift in A&E comes to an end, Seema is tired. She's been here for 17 hours.
I'm shattered. I'm emotionally drained. It's like I was at a point where I was going to make a sort of like a rash decision and just say, right, I'm going. But I got myself here and it was a struggle to get myself into hospital in these sort of like hard times, so I'm going to stick it. We're going to get emotional, to be honest, but yeah, it's just, it's been difficult, but we're just hanging in there.
Soon after, she had a procedure to help diagnose her pain and only needed to stay in for a night. The hospital will continue to care for her as an outpatient.
I can do that.
On the day we were in the emergency department, we saw a team that was under pressure, often at capacity, but managing to care for a high volume of patients with complex needs. This winter, the physical and mental health pressures are steadily increasing. The new year is likely to be busier still. Alastair Fee, BBC South Today.
And if you've been affected by any of the issues raised there, BBC Action Line has details of organisations.